Okay, go ahead.
Teddy Roosevelt first mentioned the possibility of a national health insurance system for Americans when he was running for president back in 1912. But the idea didn't gain momentum until President Harry S. Truman called on Congress to create a national health insurance fund in November of 1945. He was not successful, and it was another 20 years after another unsuccessful push by President John F. Kennedy to create a national health care plan for seniors before President Lyndon B. Johnson signed the legislation leading to Medicare for the elderly and Medicaid for the poor. On July 30th, 1965, President Lyndon B. Johnson made Medicare and Medicaid law, and former President Truman was issued the very first Medicare card during the bill signing ceremony.
I'm sorry to interrupt you. Abe, I'm not seeing the slides change there. The rest of you guys seeing the slides change?
No.
No.
Oh, really?
Is it on present mode?
Yeah, it is. I'm on the same slide that she's reading.
Yeah, so can you take it off present mode?
Yeah. Let me see.
There you go.
Oh, can you see it there?
Yep, we can see it now.
Okay, then I'll just leave it like that. Sorry.
No, you're good. Okay, go ahead, Dory.
Should I start over?
Sorry, no, just go ahead and go from where you left off. Sorry.
From where I left off, okay. In 1972, the first major change was made to Medicare, expanding coverage to include individuals under the age of 65 with disabilities and end-stage renal disease. In 1977, the Healthcare Financing Administration, or the HCFA, was created to administer both the Medicare and Medicaid programs. The Omnibus Reconciliation Act of 1980 expanded home health care services and brought Medigap or Medicare supplement insurance under federal oversight. In 1982, hospice services for the terminally ill were added. The Balanced Budget Act of 1997 established the State Children's Health Insurance Program, or CHIP. The Breast and Cervical Cancer Treatment and Prevention Act of 2000 gave states the option to extend Medicaid coverage to uninsured women with breast or cervical cancer, regardless of income or resources. In January 1st, 2001, HCFA was renamed the Centers for Medicare and Medicaid Services, or CMS. The Medicare Prescription Drug Improvement and Modernization Act of 2003 established a new Medicare Part D prescription drug program, transferring drug coverage from Medicaid to Medicare for individuals enrolled in both Medicare and Medicaid. Then President Obama signed the Patient Protection and Affordable Care Act of 2010, commonly known as Obamacare, into law to reform the country's healthcare system and extend health coverage to uninsured individuals across the country. On January 1st, 2014, coverage under the Affordable Care Act Medicaid expansions became effective.
Some of the component parts of Medicare, there are three main component parts. Part A, which is hospital insurance coverage. That is for inpatient hospital care and like hospice and home health care. Part B is medical insurance, like doctor or clinical lab services, outpatient care, or even physical therapy. And then Plan D, or Part D, is prescription drug coverage. Each plan has a list of covered drugs, also known as formularies. Each plan places drugs into tires or on the formularies, and depending on how the lower the tire, the cheaper they are cheaper, and the higher, then they're more expensive.
Okay, can you guys hear me?
Yes.
Okay, there's just a little bit of a lag on my side. My part was who qualifies for Medicare, and Medicare is health coverage for individuals who are over the age of 65, if they have a severe disability, or those with end-stage renal disease. And I looked up like what counts as a severe disability, and that is anyone who qualifies for Social Security disability. And so then I went into how many people receive Medicare, and in 2014 there were 53.8 million people on Medicare, and of those 44.9 million were over the age limit. That's how they qualified, and the other 8.9 million were qualified as disabled or on disability. And out of all the beneficiaries, 76% were Caucasian, 11% were African American, 8% Hispanic, and 6% were of other ethnicities. And then I found this graph, the projected enrollment in the future, and you can see that it's steadily increasing as far as how many people are benefiting from it over the years. And then for Medicaid, Medicaid was designed for low-income families, qualified pregnant women, and children. When I first read that fact, it sounded like it was for pregnant children, but then I found out that that wasn't it. Oh, is Abe gone? To anyone else?
We lost the slides.
Yeah, it looks like we lost the slides. Does anybody else have the slides they could pull up?
Right here. How do I mirror it to you guys?
Go over to the left-hand side of the screen, and you're going to see a menu pop out. It's got a green screen with a white arrow in it. Click on enter. Yep.
Okay. Entire screen or just, right?
Yeah, do entire screen and then pull up the slides.
Okay. Are we good?
Yep, there it is.
Can you see it? Okay. Where were we? Oh, qualifying for Medicaid, right?
Yep.
So, as I said, it only, can you guys see me?
No,
Just on my screen.
Oh, sorry, I cut off. I'm sorry.
You're good.
I might have skipped a slide. I don't know which one we're on now. I'm sorry. My internet apparently is bad now.
It's okay. Did you want to keep sharing, or am I good to keep having my screen up?
I guess I could keep sharing. Yeah. Are we on the next slide? I'm sorry.
Yeah, we're on.
On this one right here?
It's right after the one with the graph.
Oh, was it this one? Oh, I'm sorry.
I'm not seeing anything yet on the screen share.
Man, it might be my computer or my internet. I mean, geez, it's always really good. I don't know.
Here, I'll pull it up, Abe. It's okay.
Yeah, and let's just have you run through it really quick, and yeah. And then we won't be able to see you, but we'll see your screen. So that's perfect.
Okay. So recently, due to the Affordable Care Act of 2010, low-income adults are now able to be qualified as well. So that basically just means you don't have to have a whole family. If you're just a single adult who wants Medicaid, you're now able to be on that. So how many people receive Medicaid in 2015? Oh, sorry. 64 million people enrolled in Medicaid, and of that 64 million, 52% were under the age of 18, and the other 48% were obviously over 18, all the way up to 64 until they qualified for the Medicare. And this, out of the 64 million, 4.3 million were the newly eligible adults that we just talked about.
Okay, I guess this one is mine. This is federal and state specific issues, Medicare and Medicaid. Medicare is a federal program managed by the Center Medicare and Medicaid services. It's also run or managed by regional contractors. For example, Noridian manages the program in states like Utah, Idaho, and California. As was previously mentioned, it's for those age 65 and older, younger disabled beneficiaries, like those on SSDI and end-stage renal patients. It also pays for 80% of hospital doctor visits and other costs, which are Part A and B, which is also mentioned, as well as the medication costs with a separate plan of Part D. Next slide. Medicaid is a federal and state program, but it is run by the state as well as local governments. It serves low-income people of any age. It requires little to no copay in order to access treatment. The coverage does certainly vary state by state. For example, here in California, California expanded Medicaid coverage as part of the Affordable Care Act. Certainly others, two additional adults, I should say, but certainly other states did not. Many states also included the CHIP program. California recently rolled that program into the Medicaid program, which in California, by the way, is called Medi-Cal, in order to save budget money. And as it turns out, as a side note, it also ended up restricting access to providers when they did that. Some beneficiaries can qualify for both Medicare and Medicaid if low income. Those are called dual eligibles or qualified Medicare beneficiaries.
Oh, sorry. How Medicare is funded. Medicare is a program funded federally, more specifically by federal payroll taxes, general tax revenues, and beneficiary premiums. It is dispensed by the Secretary of Health and Human Services. HCFA, or Healthcare Financing Administration, is responsible for the day-to-day managing of the program. But today, HCFA is called CMS, as we learned in the history section, which is also known as Centers of Medicare and Medicaid Services. In this graph, or this chart that I found, it's interesting that Peter G. Peterson Foundation compared to the 1970 to 2040, how Medicare and Medicaid has changed. And we can see that in 24 years, Medicare and Medicaid will be very close to similar, taking amount of space as Social Security. Next slide, please. Yeah. The Medicaid program is jointly funded by the federal government and states. The federal government pays states for a specified percentage of program expenditures called the Federal Medical Assistance Percentage. FMAP varies by state based on criteria such as per capita income. Next slide, please. This map is very interesting because it shows how 49 states spent more of their own funds on Medicaid. And it's also interesting, well, compared with 2000, Medicaid in 2013 consumed about 1 cent less of each dollar raised by North Dakota, but at least 8 cents more of every dollar generated by California, Maine, and Minnesota. And the reason that's interesting also about North Dakota is that the share declined because the state's oil boom pushed up revenue 175% over the period, outpacing the 131% increase in Medicaid costs. Next slide.
Okay. Medicare Trust Fund is paid by 2 trust fund accounts supported by the U.S. Treasury. The first one is a hospital insurance trust fund. How is it funded? It is paid by employers and self-employed citizens. And what does it pay for? It pays for Medicare Part A insurance. An example would be the inpatient hospital care and the Medicare program administration. And Part 2 of the trust fund is a supplementary medical insurance. And how is it funded? Through authorized by the Congress. premiums from people enrolled in Part A benefit and Part D. It pays for Part B benefits, Part D, and the Medicare program administration. And when will Medicare become bankrupt? Congress has spent monies that should have been in the Medicare trust funds. There are insufficient funds to support the baby boomer generation. The Medicare trust fund is projected to become insolvent or bankrupt around 2017. And the Medicare's insolvency pertains only to Medicare Part A, which covers hospital care for the program's beneficiaries, and it doesn't apply to Part B or Part D. Those are the references.
That's it.
All right, great job. One thing I wanted to point out, so some of the data we have in a lot of the data is a little outdated. So we're almost in 2017, Medicare is not bankrupt yet. And actually, the projection has moved out to about 2028 now to be bankrupt. I know it's not in the book.
Yeah,
so
I saw that, but I was like, on the class information, it says 2017.
Yeah, you're good.
Yeah.
Nope, you're totally fine. We need to update that for everybody. But I'll ask the question now for you guys. I'll start with Abe. What was the most interesting thing that you learned as you were studying this topic?
Well, for me personally, I guess for my section, it was interesting. I didn't know that like the states and federal government were kind of like separate in paying for Medicaid. I kind of like looked that up like for my own information, and I just thought of that as kind of interesting because sometimes I forget that the state is like its own government, its own mind, and the federal government's a little different, and together we're allowed to pay for a lot of our medical bills.
Great, thank you. Anna, same question.
Well, for me, I actually had no idea what made you qualify for Medicare. I knew that Medicaid was for low-income families, so when I got into Medicare, can I pull it up? Where'd it go? Oh yeah, I knew that be over the age of 65, and then I realized that it had to be a severe disability, what that was, and so as I did my research, it told me that it was just any disability that you could qualify for Social Security disability as well. So I thought that was pretty cool.
Great, thank you. All right, Annie, same question.
For me, it was interesting. I didn't really know a lot about Obamacare before, but then also so reading about this and then learning a little bit about Obamacare and then also more about Medicare. I've heard of it, but I never really truly understood the difference between both and who qualifies for it. So learning about that really actually was helpful and will still be helpful.
Great. All right, Doreen.
Well, I thought it was interesting that a national health insurance program was suggested so early on, back in 1912. That was a long time back, and it didn't get passed, of course, till 1965, but still, that was just interesting to me.
Right, yeah. And that's an important thing to remember for tests coming up, 10, wink, wink, 1965 and Lyndon B. Johnson, so make sure you guys remember that. Great, thank you, Doreen. All right, Karen.
The most interesting part for me was I didn't know that recently, due to the Affordable Care Act, the low-income adults can now be able to qualify as well. And I also learned a lot about the Obamacare, how it has played a role in Medicaid and Medicare, and also about I had no idea Medicare was going to become bankrupt. That's kind of scary. So it was interesting to learn.
Great. Definitely something that's scary.
Yeah.
For sure. All right. Thank you. Tracy.
Yeah, there was one specific thing I actually didn't know, that that it's end-stage renal patients that can qualify for Medicare. I was familiar with the other areas, but that was a revelation to me that they would really target that one specific disease like that.
Yeah, that's definitely that was something that interested me as well. You know, I never had realized that before this class, I didn't realize the end-stage renal failure was something well, regardless of age on that. So that's very interesting as well for me. All right, so I'm going to stop recording.